Now, in the press statement issued last week here by me, the COVID-19 positivity rate in the country as a whole was then 15.1%. Today, the positivity rate stands at 11.8% from a sample size of 4,134 individuals tested. That may indicate that the positivity rate is going down, but this is an average figure, and specific cases must be understood in their specificity. Those figures are no reason for us to be complacent at all in the fight against COVID-19. We note that community transmissions have started increasing, and other counties out of the zoned area, that is mainly Nairobi and Nakuru, are experiencing a surge in COVID-19 infections, including my own county, Kisumu. As county governments, we will strive to ensure strict adherence of health protocols by all counties, especially those outside the zoned area. We continue to urge members of the public to work collaboratively with the national and county governments towards the fight against COVID-19. In the last 1 week, county governments have addressed themselves to the following critical issues. 1, status of bed capacity in 32 counties. The bed capacity in 32 counties is as follows. 1, there is a total of 7,446 beds in 390 isolation centers, out of which 5,912 beds are available for patients. In other words, we have enough beds at the moment to cater for those needing isolation in counties nationally. Secondly, there are a total of 390 beds in ICU, out of which 228 beds are available for new patients. And thirdly, there are a total of 156 beds in the high dependency units, of which 69 beds are available for new patients. In other words, the issue of beds in isolation, ICU, and high dependency units nationally in all counties doesn't at the moment raise any alarm. Let me now address myself the COVID-19 vaccination, an issue that every Kenyan is concerned about. Cumulatively in 32 counties, a total of 409,722 doses have been received, out of which 303,163 doses have been administered as follows. Health care workers, 87,353 of this category has been vaccinated. Among the security personnel, 14,813 have equally been vaccinated, and teachers, 30,701 have been vaccinated, and other categories account for 170,926 persons. County governments are working towards ensuring that the targeted population in phase 1 are vaccinated within the stipulated time frame. Further, we urge the Ministry of Health to increase the number of doses distributed in order to meet the target and stem the spread of the virus. You all know the advantage of being vaccinated, and hence it is important that especially those in high groups, by myself over 58 and others, do get vaccinated. 3, testing and home-based care. Out of 83,766 tests carried out in 32 counties, 9,694 tested positive. That's just about 10%, over 10%. Of this number, 5,319 positive cases are under home-based care, while 1,434 are in isolation facilities across the 32 counties. A total of 28,057 have recovered from COVID-19. The recovery rate is actually quite appreciable. As you know, that COVID-19, especially in its zoned areas, poses a lot of food security problems. In line with the implementation of the county COVID-19 social-economic reengineering recovery strategy that the COG initiated, which seeks to facilitate access to quality and affordable inputs, including certified seedlings, county governments have distributed a total of 2,242,243 of assorted high-value food tree seedlings and 77 tons of crop and pasture seeds. This will increase agricultural productivity and income of farmers during this period, hopefully. Further, county governments have continued to facilitate transportation of food and other essential commodities across counties. All markets are operational with water and hand washing points provided. 6. In the water sector, provision of water is integral towards the fight against COVID-19. However, water utilities have continued to accrue operational bills since the first wave of COVID-19 in our country. This has led to a decline in revenue, which has affected service delivery. To avoid the situation, 26 water service providers have so far received liquidity support from the World Bank, which will go towards offsetting accrued electricity bills. We urge the World Bank to fast-track their support towards the remaining water service providers in order to ensure uninterrupted service delivery. We nonetheless face major challenges in counties. The first one I want to talk about, which is a major challenge I talked about last week and continues to be a challenge, is the disbursement of county equitable share of revenue. I noticed that the Senate, in its sitting yesterday, has dealt with the division of revenue bill, but the challenge as we face it today is as follows. In the last 1 week, the National Treasury has disbursed a total of 19.8 billion shillings to county government, following our appeal last week. The current outstanding amount owed to county governments is shillings 66 billion. Shillings 66 billion. Of this 66 billion, 2.6 billion is owed to Nairobi City County for the month of December. Secondly, of this 66 billion, 12 billion is owed to 21 counties for the month of January. 26 billion owed to 47 counties for the month of February. 25 billion owed to 47 counties for the month of March. In other words, the 19.8 billion released by the Treasury so far is a small drop in the bucket. We urge the National Treasury to fast-track the release of the outstanding amounts to enable county governments to undertake county operations and progressively settle the pending bills. In the tourism sector, the impact of COVID-19 pandemic on the tourism sector has been substantial, which has drastically affected tourism facilities across the counties. As you know, tourism is an important aspect of not only employment in counties, but revenue generation in counties as well. County governments have now embarked on developing products specifically tailored to enhance domestic tourism, which is less susceptible to economic shocks. And therefore, I appeal to Kenyans, after the lockdown, please join us in touring our own counties and discovering what exists in Kakamega forests, as well as forests as far north as Marsabit. Try to find out which are the newest resort areas in your county, because they do exist. The tourism products being developed are premised to be affordable and will maximize domestic tourist facilities. Regional boards are now jointly marketing tourist attractions, and you might have seen some of this marketing initiative in our own media houses, as you know. Thirdly, floods in the counties. Following an advisory from the Meteorological Department issued on Monday, the 12th of April, 2021, heavy rains are expected to intensify, particularly in the western region, Nyanza, Rift Valley, and Tana River County. In this regard, we urge all members of the public living in flood-prone areas to move to safer grounds. County governments have already mapped out the vulnerable individuals, and they will work closely with other partners in supporting families that have been displaced. Fourthly, depleted vaccines. Since the leadership of both the national and county governments took the vaccine publicly, the confidence of the citizens was enhanced, and there's a serious demand for the vaccine now. Many county governments have depleted resources of what they had in store. This, ladies and gentlemen, is a good sign, but also a challenge, since we have a shortage in other counties in the country and globally. As you know, India is facing a very big challenge in exporting vaccines due to domestic demand in that country. Fifthly, special audit report on use of COVID funds by counties. County governments have not received these reports being discussed in the media relating to audit of utilization of COVID funds by counties. We urge the media to be patient and allow the counties to receive the reports from the Office of the Auditor General, study them, and then respond to any audit queries, if any. As you know, audit reports are audit reports. There is question, perhaps for lack of documents and so on, but I think it's rather premature, really, to make judgment on these reports until and unless we have received them and we have had discussions with the Auditor General Office as to how they arrived at their contentions. Counties are being condemned and heard, and even without being told what they did. That is wrong, if at all. We are prepared for the report, but we would need, as in a court of law, to be given the opportunity to respond to whatever is accused of the counties. Conclusion. In the recent past, COVID-19 has continued to claim the lives of our families and loved ones, as seen in the daily situation reports by the Ministry of Health, reports of which are available to you every week. To stop this trend, we have to strive to flatten the curve, which can only be achieved through adherence of the health protocols. I therefore urge every individual to exercise extra caution to protect themselves and the lives of others in order to minimize the spread of the virus and reduce the fatalities. In that regard, we must all wear the mask, wash our hands, and maintain social distance. Asanteni sana. My sister, it is a tragedy. We, like you, are very worried because it means all that we plan to do this financial year are in jeopardy. And, you know, it are the citizens of this country, all of whom live in counties, who will suffer by the non-delivery of services. My heart also bleeds for those who have offered services to the counties and who have not been paid because of pending bills. We need money, in time, as scheduled in the Constitution and other relevant documents of government, so that county governments can function properly in service of the people.
Now that India is having an issue with export, are there any other places Kenya has highlighted probably get the same?
I think that question you should address to the CS in charge of health. That is his territory, and I'm sure that the CS and his team are quite prepared given the current situation internationally. I think I gave those figures last week, and they are available. I can't quite remember, but I will tell you that every county is striving to install oxygen plants. Generally, if you don't have an oxygen plant, you can get oxygen from the suppliers, BOC, for example. Our committee, the health committee, have had a meeting with all, plus the Ministry of Health, we've had a meeting with all the oxygen suppliers, and we are in a plan with them on how to supply oxygen to the counties. We also pleaded with oxygen suppliers, if possible, to play down the production of industrial oxygen and give priority to the health oxygen that we need. And I think there should be any cause for worry. I do believe that, of course, in certain instances, there can be a surge in admission to isolation centers, intensive care units, and HDUs, which suddenly demands the rise of oxygen. But we have a system regionally that we can share oxygen among ourselves if need be. KEMSA? Well, look, the thing is that if KEMSA doesn't have the oxygen or cannot supply the oxygen in time, we have to get it. But if they do, sure, they can supply. There's no God-given reason why, if they do have oxygen, they cannot supply it to countries. But that is up to them as KEMSA to respond to the needs of the county governments and county health facilities. Asante sana bwana. Let me not leave here before putting my coat. I hope these things were sanitized, eh? Okay. They were, eh? Yes. You saw it? Okay.
Nisaidie hiyo kopi ingine. Zipi?